Back on the subject of state medical boards, you've had some complaints against your license against the state, correct?
Yes. So I had 3 complaints, and they all involved ivermectin. So one of them was a 17-year-old. I spoke to the dad and the stepmother. They wanted to have the ivermectin on hand as they were traveling abroad. He never even took the ivermectin, but his mother was fearful and reported me to the medical board. And that case was recently dismissed. Then I have 2 cases from hospitals, one from Houston Methodist and one from Texas Hughley. Houston Methodist said I was spreading dangerous misinformation. At the time, I said I was actually much more conservative than I am now. And I said things like ivermectin works and vaccine mandates are wrong. And they got upset with that and suspended me. And you may know the story, but they suspended me in a very public manner. So they went to the Houston Chronicle, and that's how I found out that my privileges were suspended, because I had a reporter ask me about it. And then they also went on Twitter to announce it. So in response to that, I resigned. They turned me into the medical board for resigning while I was under investigation. So we have that issue. And then the other case was a patient that was dying. He was in the hospital, had been in a coma for a month. The wife sued the hospital because she wanted him to have the opportunity to try ivermectin. She asked me to be the expert witness, and as part of the lawsuit, they needed a physician willing to write the prescription for ivermectin so that, they'd have that access to it. So that's what I did. And they turned me in for unprofessional behavior, just as part of fighting for this patient.
The hospital did.
Yes.
Yeah. And that's what's interesting about these cases. Not in any of the cases you just mentioned, no patient was harmed. And
no.
And outside of the first one, which is super ridiculous, and I'm sure if we look into the first one that was just dismissed with the mom turning you in, I'm sure there's a lot more dynamics going on than what we might even know the details of. But it's interesting that the board even heard that case. I mean, the patient never even took the drug. It doesn't matter.
Right. Exactly.
I mean, seriously. I mean, and
it took a year and 8 months for that case to get dismissed.
Right. They when they first saw it, and they said, "Well, patient never took the drug. Okay, we're not even going to investigate." We've been investigated from the state board because it's so easy for patients to file complaints now. Online. It's really easy. And we had one time where the patient was upset because we couldn't get 1 ml syringes. So we dispensed her hormone cream in 3 ml syringes. And it didn't go well for her. And we're not surprised she filed a complaint. But, the state board investigated us for it. And, that would be like putting it in a 30-gram bottle instead of a 60-gram bottle. Nobody was harmed. And we didn't have the 1 ml syringes. The state board should have never even heard the case.
Right.
They said, this has no validity, but they've got to follow up on all those things. And we have turned our state boards of medicine, our state boards of pharmacy, instead of turning them into colleagues that we can reach out to and say, "Hey, I've got something going on here. What should I do?" It's so adversarial. We don't even ask anymore because we're afraid if we say, "Hey, asking for a friend," next thing they'll show up in our office and say, "Well,
right."
Exactly. And it's not how that's not how it used to be, and it wasn't meant to be that way.
Well, and we get a monthly, wall of shame email from the Texas Medical Board highlighting all the horrible misdeeds physicians have done. And it's things like sexual misconduct, drug abuse, severely harming people. It is not, prescribing a very, very safe drug off label.
Right.